Hello everyone, I'm Dr. Sneha Sood, Consultant Dermatologist with Aster RV Hospital, JP Nagar, Bangalore. Today we are going to talk about hair fall associated with COVID-19 infection. In the past 1 year, we have hair fall associated with the COVID-19 infection. People who are affected with COVID-19 who had different types of infection, different severity of infection, and also people who are not even affected are also experiencing hair fall post COVID-19. Why this is happening and what exactly is this hair fall? This hair fall is called telogen effluvium. Basically, telogen is the shedding stage of the hair. So this is a time where excessive hair enter into the shedding phase at the same time. This is a temporary hair loss which is associated with mostly any fever or any illness in the body. And usually in this type of hair loss, you can lose up to 300 to 400 hair every day. Generally, when we talk about hair cycle, we have three stages in this hair cycle. So the first stage is anagen, where your hair is healthy, it is growing, and this stage lasts for 2 to 6 years in any healthy individual. Post that comes a stage of catagen, which lasts for 2 to 3 weeks. It is a temporary stage, it is a stage of shrinkage. And after this stage, the hair enters into the shedding phase, which is called telogen. Generally, everybody, all of us, we are born with around 1 to 2 lakh hair on our head. So 1% of hair at any point of time will be in shedding. So that means we are supposed to lose around 100 to 150 hair every day. When the number exceeds this number, that is 100 to 150, that is where we call it telogen effluvium, and that is where it is significant hair loss. Most people after COVID-19 see this excessive hair fall after around 2 to 3 months of the illness. They can see handfuls of hair coming out while showering, while brushing your hair. You can see hair all over your house also. And this type of hair fall can last up to 6 to 9 months before it is going to stop on its own. Most of the time, luckily, this hair fall doesn't lead to any reduction in hair density, and the hair density stays normal. As and when your hair will stop shedding, you will start getting new hair growth, and ultimately your hair density will come back to normal. Now, another factor that can also lead to hair fall is emotional stress. And all of us, everybody is stressed out because of pandemic. Various aspects like working from home, anxiety about stepping out, anxiety about the condition and what's going to happen in the future. We are all worried about our family members and our loved one around us. And because of this, the stress can also lead to hair fall. What can be done about this hair fall and what to expect? Once this hair fall starts, it is going to return to normal on its own. You don't, even if you don't take any treatment, this hair fall is going to ultimately stop. For most people, this is going to happen around 9 to 12 months once the hair fall starts. And once the hair starts to grow back, you'll start seeing multiple small hair, which will be around the same length, distributed all over the scalp. And this is what indicates that you are getting your hair back. What can be done on your part? Making sure that your diet is good and managing your stress well are the two most important things what you can do to manage this hair loss. Eating healthy, a diet rich in protein, carbohydrates, rich in vitamins, micronutrients, and minerals is very, very essential to make sure that your hair grows well. Also correcting any underlying deficiencies like iron deficiency, vitamin B12, vitamin D3, or protein deficiency is also very important. Managing stress includes doing a bit of yoga every day, meditation, and exercise regularly. It will help in calming your mind down, reducing your stress, and exercise also will produce dopamine, which is basically a happy hormone for all of us. When to see a doctor? If your hair fall is associated with any rashes, any burning sensation, any itching over the scalp, there can be another cause for this excessive hair fall, and that's what we need to treat. If this hair fall is purely telogen effluvium, we can help you with some growth peptides, some growth factors, which will help in limiting out the hair fall and also ensuring that new hair growth happens faster. Any underlying deficiency, as I already mentioned, also needs to be corrected. If in case your hair fall is not reducing despite all the usual measures, we also can do some procedures like platelet-rich plasma therapy or mesotherapy to correct this type of hair fall. Basically, as a person, this hair fall can be very scary. Losing up to 300 to 400 hair every day can be very scary and very worrisome to everybody. But then the good news is this hair fall stops on its own. What you need to do is keeping your mind calm, relaxing, making sure you eat healthy, and not fussing or festering a lot about your hair fall, right? Uh, thank you.